Menstrual periods are supposed to be a normal occurrence for each and every woman. However, most women experience abdominal pains during their menstrual periods. This is so unpleasant that it at times causes stress and depression, especially in the young girls who are just starting their menstruation. It can also lead to low self-esteem and loss of jobs at times. Just imagine yourself communicating to your boss that you failed to attend work because of periodic pain. Therefore, we need to address this issue in this video. We are going to look at the different types of periodic pains. We are going to look at the causes of periodic pain, treatment, and how you can get rid of them at your home. I mean the home remedies for periodic pain.
Ask Dr. Othman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Othman YouTube channel, a channel where you learn medicine at the comfort of your living room. I told you if you'd like to get in touch with me to ask me a question privately, go to my website www.drothman.com and make an appointment. We shall have an online consultation and sort you out. You can also find us on all our social media platforms. Ask any question of your choice. We shall be right there to answer you. I know most of you have been following. We've been dealing with infertility and we had reached episode 3, and I expect you to be waiting for episode 4. However, today we've decided to interrupt that programming and bring you another issue which has been asked most in my inbox, and that is about menstrual period pains. Pain during menstruation, or what we call in science dysmenorrhea, is abnormal. It's absolutely abnormal for someone to feel pain while undergoing their menstruation. Actually, menstruation is supposed to be fun for most women, but most of them receive very unpleasant pain. This pain can be in the lower abdomen, or what we call the pelvic region, but some women can also feel it at their back, and that's what we call radiation of the pain. And at times this pain can also be referred, or it can radiate to the thighs, and someone feels pain in the thighs, they feel pain at the back, they feel pain in the lower abdomen. This is what we call dysmenorrhea. This kind of pain, or dysmenorrhea, is categorized into two. There is what we call primary dysmenorrhea, or primary period pain, and then secondary dysmenorrhea, or what we call secondary periodic pain. Let's look at each and every category we are talking about. Primary dysmenorrhea. Primary dysmenorrhea happens to a woman whereby you are feeling pain during menstruation, but there is absolutely no damage to your pelvic organs. What do I mean? In the pelvis, we have the uterus, the ovaries, the fallopian tubes, and so many other structures. So if those structures have a problem, then you can experience abdominal pain during menstruation. But if they have no problem at all, they are all normal, and a woman goes on to experience pain during menstruation, we call that primary dysmenorrhea. This pain is so characteristic that it usually starts actually when a girl is starting menarche, or they are starting menstruation. Usually they start with that, they start getting the pain from that particular time until adulthood. And also this pain, most of them radiate to the back. And these pains are also associated with heavy bleeding. You'll find that the woman is having heavy blood, and then they will have that menstrual period. What causes this? Because we've seen that there is no abnormality, absolutely no abnormality in the pelvic organs. The uterus, the tubes, everything is normal. So what is causing this pain? There is a friend of ours called prostaglandins. Prostaglandins is one of the hormones, is one of the chemicals, secreted by the body. And you find that these people with primary dysmenorrhea secrete high levels of prostaglandins during that period. And prostaglandins cause or stimulate the contraction of the uterus, of the endometrium. You'll find that the endometrium is contracting, and then after contracting, of course, the person will feel pain. How will this occur? During contraction, there is constriction or narrowing of the blood vessels that are supplying, or blood vessels of the endometrium, or the blood vessels of the uterus. So when these blood vessels are narrowed, it means that less blood is going to supply the endometrium. So because less blood is supplying the endometrium, it means less oxygen is reaching the muscles of the uterus. When there is less oxygen reaching the muscles of the uterus, the muscles will pain. And this is the same pain people feel, what we call the cardiac pain. If we look at that also, if we look at the explanation of that cardiac pain, you'll find that it is the lack of oxygen that is causing the pain. The same thing is applied here in the uterus, that someone will feel the pain because of the reduced supply of oxygen. And this is coming from increased levels of prostaglandins, increasing uterine contractions, reducing or narrowing the blood vessels, thus reducing blood supply to that part, and thus reducing oxygen to that part, and the person will have pain. And this is what we call primary dysmenorrhea. I told you, like in the beginning, that most of these women also have heavy bleeding. They have heavy bleeding. So the same thing will happen. Because you're having heavy bleeding, especially with clots, the uterus has to contract. It has to contract in order to eliminate or to push out that clot or to push out that blood. And in the process of contracting, the uterus or the uterine muscles are again going to constrict the blood vessels. When the blood vessels are constricted, less blood supply to that area. When there is less blood supply to that area, you remember in our science, we said that red blood cells carry oxygen. Therefore, if the blood vessels are reduced, blood supply is reduced, it means oxygen is also going to be reduced in that particular area, and therefore you are going to feel pain. There are some risk factors for getting primary dysmenorrhea. What do I mean by risk factors? I mean that if you possess any of the following, there are high chances that you will get primary dysmenorrhea. For example, if in your family history of primary dysmenorrhea, if in your family there is someone or your parents and so on have been having primary dysmenorrhea, it means you also have a high chance of getting this dysmenorrhea. Another issue is early menarche. What do I mean by early menarche? Ladies or girls who begin menstruation early, especially girls who begin menstruation at 9 years, 10 years, or what we call below 11 years, they are at a very high risk of getting primary dysmenorrhea. People who smoke, and then lastly is obesity. I have not read anywhere where obesity is important for human health. So here it comes, it is also one of the risk factors for getting primary dysmenorrhea. Now we need to look at secondary dysmenorrhea. Secondary dysmenorrhea is whereby there is an underlying pathology in the pelvic region. What do I mean? There is an abnormality in the pelvic organ. So we said that in the pelvis we have the uterus, the fallopian tubes, the ovaries, and so on. If any of those structures has an abnormality, or if any of those structures is sick, then a woman can experience pain during menstruation. This pain is also characteristic in such a way that at times they even feel pain even before a week prior to menstruation. So that pain can happen at any time, though it intensifies during the menstruation or during the menses. So what can really cause secondary dysmenorrhea? Number one, and the major cause, above 80% of women with secondary dysmenorrhea have endometriosis. What is this animal called endometriosis? Endometriosis is a condition whereby the underlining of the uterus implants itself somewhere else. What do we mean here? If you look at the uterus has a space inside. I guess everyone understands our uterus or the womb. It has a space inside. So the membrane that underlines that uterus inside is what we call the endometrium. And it is this endometrium that bleeds during menstruation. Actually, during menstruation, when the egg is not fertilized, the underlining of the uterus will be shed off. And this is where menstruation comes from. I mean, this is where menses or blood comes from. That is menstruation. Now, what happens when this underlining of the uterus or the endometrium is implanted somewhere else? For example, outside the uterus, in the ovaries, or just in the pelvic cavity, what will happen? The time someone is supposed to bleed will come, and therefore that person will bleed. Bleeding will occur outside the uterus. And when bleeding occurs outside the uterus, there is no way it can be eliminated, because normally when there is bleeding in the endometrium or inside the uterus, blood will be propelled or will be pushed out through the cervix, and then someone undergoes menstruation like you see. But now when bleeding happens outside the endometrium, for example, in the ovary, in the tubes, or even outside the whole structure, and it happens in the peritoneum, somewhere there, then blood will be there, and it has no way it can be eliminated out, and that will cause pain. Therefore, endometriosis is one of the major and main causes of secondary dysmenorrhea. I guess you've understood me. I have said that endometriosis is whereby there is implantation of the underlining of the uterus outside the uterus. And when that happens, there will be bleeding outside the uterus. And that bleeding outside the uterus will cause that discomfort, will cause that pain. Another cause of secondary dysmenorrhea is adenomyosis. Adenomyosis is like a friend to endometriosis. What happens in adenomyosis? I am sorry, my friends, these terms are really big, but I will try to explain them. Adenomyosis is whereby the underlining of this uterus is now implanted within the uterine muscles. What do we mean? When we are looking at the uterus, we say the uterus has 3 layers. It has that membrane which is outside, all the muscles that are outside the uterus. Then there are muscles in between, and then muscles inside. So there is that layer outside, the layer in between, and then the inside, the inner layer. So at times in some people you find that the underlining of the uterus, the endometrium, will implant itself in the middle of the muscles of the uterus. And when this happens, of course, bleeding will occur in the middle of the muscles, inside the muscles. And when bleeding occurs inside the muscles, again, severe pain is going to occur during your menses. What else can cause secondary dysmenorrhea is ovarian cyst. The ovarian cyst, I discussed about the ovarian cyst, and I guess if you'd like to get more about the ovarian cyst, you can check one of my videos concerning ovarian cyst. These ovarian cysts are one of the causes of secondary dysmenorrhea. PIDs, pelvic inflammatory diseases, I also discussed about this, but they can also cause secondary dysmenorrhea. There are also what we call polyps. Polyps, they are like growth within either the uterus or at the cervix or anywhere in the pelvic region. Those polyps, all the growth, all the masses can cause dysmenorrhea, which is secondary. And lastly, I will talk about fibroids. Fibroids, we talked also about the fibroids. I will not expound them. If you would like to know more about the fibroids, again, reach out to one of my videos down there. You'll understand what fibroids are and how they actually cause secondary dysmenorrhea. But now, most importantly, we would like to know how you can help yourself. We are looking at the self-help, the home remedies, what you can do if you have this condition, whether it's primary or secondary, but mainly it should be the primary. The primary, there are many things you can do about it. But for the secondary, you need to go to the hospital and they treat the cause. Because we've seen that for secondary dysmenorrhea, there is absolutely an underlying cause. There is a pathology within the pelvic organs like endometriosis, adenomyosis, PIDs, or any of those infections and so on. So if you have any of them, then you need to go to the hospital, get treatment. Of course, dysmenorrhea will go away. But if it is a primary dysmenorrhea, this one you have no control. You will not do anything about it. There is no disease known that you can treat. So what are you going to do? You're going to do something at home in order to get relief. Number one, we recommend exercise. Do some exercise. Exercise actually has shown that it leads to production of endorphins. Endorphins are like feel-good hormones. I don't know if you understand this. When you do exercise, they stimulate production of endorphins, and endorphins are those hormones in the body that make you feel good. So even during that kind of displeasure, feeling that pain, the endorphins can act in a way that there is no pain and you feel good. So exercise can help. You can do some yoga, you can do jogging, you can do some good exercise, and then you can have relief of that pain. What else you can do is to use warm water. You can get warm water, you can either drink it, and some people put it in the bottle or some in a container, and then just massage it in the lower abdomen. Something else you can do is to take a position that is comfortable for you. There are some positions that are really good, that are helpful for someone. For example, the bend, if you bend upwards or you bend in front like you see in this picture, if you have that pain and you take that position, some people will feel some relief. Now, if all those ones cannot work for you, then we go to the next step, and that is the medication. You can buy some medicines. They are over-the-counter medicines called NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. Examples of these drugs are ibuprofen, celecoxib, diclofenac. Those medicines can help you to reduce that pain. Why? Because NSAIDs will act on, remember we talked about the main cause of this primary dysmenorrhea is the production, excessive production of prostaglandins. You remember? So what these NSAIDs will do is to reduce or to inhibit the secretion of prostaglandins. And when the prostaglandins are reduced, of course the pain will also reduce and it will go away. So you can take painkillers, or those painkillers we are talking about. Ibuprofen is one of the commonest NSAIDs used, so you can use ibuprofen, or what you people call brufen. You can use diclofenac, you can use celecoxib. You can also use mefenamic acid. Mefenamic acid is a little stronger than the above. There is also tranexamic acid and so on. So when you're using those NSAIDs, you should also remember that they are not good, or they are not supposed to be used in some conditions. For example, if you have ulcers, then NSAIDs are not a go area for you. People with bleeding disorders, if you have any bleeding disorder, or your doctor told you have a bleeding disorder, you have such kind of disease, if you have asthma, then ibuprofen, all those NSAIDs may not be good for you. And therefore, you should also first seek advice from your doctor before you use them. Now, if the pain persists after using your ibuprofen, you've used diclofenac, or a combination. By the way, if you also get a combination of ibuprofen or a combination of diclofenac with paracetamol, or what most people call Panadol, if you get that combination, it can be better off for you to get relief of that pain. So, but if the pain fails, if it persists, then you need to go to the hospital and get more advanced painkillers, because we have what we call the analgesic ladder. If we use the NSAIDs and they are not able to work, we can go to other painkillers like the opioids and so on. We can even reach the level of pethidine. I have received several cases whereby you give all those painkillers and they fail to work in this individual, and we end up with even those higher painkillers like pethidine. Some other medicines that can be used to stop this pain are the oral contraceptive pills. Actually, if you use the other analgesics and they really don't work for you, then we can opt for oral contraceptive pills. But we, of course, use these oral contraceptive pills in a person who does not want to give birth in the near future. So how will they work? These oral contraceptive pills stop ovulation. And when ovulation is stopped, of course, the prostaglandins will not be stimulated. And when prostaglandins are not stimulated, we've seen it in the first up there, of course, you will not have this pain. If you are watching this video or this channel for the very first time, please don't leave without subscribing and also pressing the notification bell. I told you, if you'd like to get in touch with me to have a private consultation with me, log into our website www.druthman.com. Make an appointment. We shall have an online consultation and sort your issues out. Also, you can check us on all our social media platforms. They are all called Ask Dr. Uthman. We shall interact and find a solution for you. I sign out.
Ask Dr.